Hi guys, I'm Dr. Mahmood. I'm here with my lovely patient Robin. She is about 2.5 months out from a tummy tuck and lipo of the sides and then submental lipo. Robin has very graciously agreed to let us ask her some questions, show her before and after pictures. And the reason we're doing this today is I think a lot of patients ask me if I'll film in the operating room, film surgeries, and I've thought about it a lot, and I really think that that's a sacred space. I want to take it seriously. I want people to know that surgery is a really serious thing. But I think it is helpful to hear a patient's experience who's been through the process and kind of what their perspectives are having had surgery and recovering and all that. So Robin, how old are you?
35.
35, how many kids have you had?
1.
All right, so 35-year-old mom, much like many of my patients who are moms or young girls. And Robin, kind of why don't you tell us what made you decide to have a tummy tuck, lipo of your sides, and all of that?
So I had a lot of belly fat, love handles, back rolls, and I wasn't confident at all. I was kind of accepting the fact that I was never going to be skinny and I was never going to have a curve, have a figure, and I kind of accepted it for a while, and I decided that I didn't have to. And so I made the decision. Actually, I thought about it for a really long time before I actually did it, and it was the best decision ever because I'm a whole lot different now. I actually have a curve. I'm feminine. I'm female. So, yes.
We love Robin, as you can tell. So Robin, why don't you tell us a little bit about how has your view of yourself even changed? I mean, it's obvious from when you walked in the door to now, and this is probably my favorite part of surgery. And I think people think cosmetic surgery is just a vanity thing, and for a lot of people, it's life-changing. Some people, I had a woman who years ago had been abused by her husband, and she never felt she was pretty, and the tummy tuck for her was a whole nother life, finally being able to call herself pretty. So it's not just a tummy tuck. But why don't you tell us kind of how your view of yourself has changed?
I have confidence. It is amazing to, first of all, not have to wear girdle on a daily basis, because I did. Not just any girdle, the extra elastic, strong one that sucked you in and made you sweat extra and smelly underneath there when you sweat too much. It was bad. So now I'm able to wear clothes that I actually like, that I look good in. I have on a big shirt today. I don't need it. I just have it in my closet and I can wear it for fashion now, not because I need to. So confidence was my thing. That was my overall top experience of this. Now I'm able to feel pretty. I can look myself in the mirror and actually like what I see. And I did this for me, not for anyone, but for me. I wanted to be able to look at me and see that I can actually like what I see. I can feel good about what I see.
I'm so glad Robin said that. This is unprompted, because I think that's a great point. A lot of people come in and they're doing things for the wrong reason. They want to be accepted by somebody. They want to fit some Instagram image, a filtered image, and those are the wrong reasons. And I think our job as a plastic surgeon is always to figure out if someone's doing it for the right reason is for them and only them, not for any motivational factor. It's really just their own happiness. So Robin, having said that, what would you tell women, and there are a lot of women who reach out to me on Instagram or anything that are in your shoes and they're unhappy, but they're afraid to kind of even walk through the door. So what would you tell them?
First of all, do your research and don't be afraid of it. Just make sure that you thoroughly do your research. Although, if you're asking me, don't go to anybody else but Dr. Mahmood, because I am living proof that she is the best. Not that I've experienced anybody else, but I'm not going to. I don't plan to. Anything I need tweaked, fixed, it will be through Dr. Mahmood. But do your research. It's important. Make sure you get someone that's really good and experienced and have been doing this for a while, not just some person that, because they're cheap, you decide, hey, I'm going to do it. That's $2,000. This is your body we're talking about here. This is not something that you could toss to the side 2 years from now because you decide, hey, I don't like it. So do Dr. Mahmood.
So funny. No, and that's a great point. We always, as board certified plastic surgeons, emphasize the fact that plenty of people want to get their hands in cosmetic surgery, whether it's in the US or internationally, and I see a lot of patients that have had surgery from other people that are not qualified to be doing them. It is very hard for us to do tertiary revision surgeries. My motto is always do it once, do it right. You look at where you eat dinner, where you get your nails done. Your body should be the most sacred thing. You have one shot to really have it look good. So really know what you're doing, and you should feel comfortable with your surgeon. That's my biggest thing. patient education, feeling comfortable with your decision. You should be excited to have this surgery. So I'm going to show you Robin's before and afters really fast. And again, Robin's only 2.5 months out, so she still has healing to go. And as you can see, I mean, she has a beautiful waistline that she, you know, we were just talking about. It's hard to imagine that's even her, except that her tattoos are the same. But she's only 2.5 months out, and she looks like a totally different person from her stomach and everything. So, Robin.
That's me. That's me. That's really me.
Thank you for sharing this with us. And again, you guys know how to reach me. Feel free to ask me questions on Instagram, DM me, email me, anything. I'm always happy just to educate people. So, thank you.